Good morning. Today I am going to present congenital ectropion Uveae with ptosis. There is no financial support or sponsorship. There is no conflict of interest. Congenital ectropion Uveae is a rare anomaly associated with various systemic and ocular conditions. We report a series of 3 patients presenting with congenital ectropion Uveae associated with ipsilateral ptosis and glaucoma. Association of CEU with craniofacial defect is also seen in one of our cases. Case 1, a 12-year-old girl presented with gradual loss of vision in left eye associated with drooping of left upper eyelid for 8 years, associated with enlargement, outward protrusion, photophobia of the left eye. On irregular basis, she was using topical beta-adrenergic blockers that was prescribed elsewhere. On examination, vision in left eye is reduced to hand movements close to face with proptosis of 17 millimeters in Hertels, and on Goldmann applanation tonometry, IOP was 48 mm of Ag in left eye. 2 mm ptosis with good levator function was seen in left eye. In right eye, slit lamp examination was within normal limit. In this picture, we can see there is drooping of left eye, left 2 mm ptosis. On further examination, left eye pupil is round with anisocoria and 360-degree ectropion Uveae, which is also shown in the following images. Right eye has normal findings. On gonioscopy, left eye has anterior insertion of iris, which is noted in all the quadrants. Fundoscopy reveals glaucomatous changes in near total cupping in left eye, shown in the following image. Initial medical treatment was given. IOP was reduced to 32 mm Ag and vision improved to finger counting 1 meter. Patient refused surgery that time and was not, controlled medical treatment was given. But after 1 month follow-up, IOP was not getting control and it still remained 40 mm Ag. So left eye trabeculectomy with mitomycin C was planned and IOP reduced to 18 millimeters Ag and vision improved to finger counting 2 meters. Case 2, a 15-year-old male presented with progressive diminution of vision in left eye and headache for last 1 year. History of previous surgery of cleft lip and cleft palate was done at the age of 4 months, shown in this picture. And the patient was already under treatment with bimatoprost and pilocarpine in left eye for last 1 year. Vision in left eye was 6/24 and right eye was 6/6. IOP by Goldmann applanation tonometer was in elevated, that is 34 mm mercury, on 2 anti-glaucoma medication. Right eye showed normal findings. Left eye had 2 millimeter ptosis with good levator function. On further examination, 360-degree ectropion Uveae was seen in left eye. Gonioscopy shows high insertion of iris without any synechia in left eye, also shown in the following images. And right eye has wide open angles with normal fundus features. Left eye has glaucomatous fundus changes, shown in the image. Management, left eye trabeculectomy with mitomycin C was performed and IOP was controlled, 10 millimeter Ag it was maintained and no further loss in visual field and IOP was noted. Case 3, a 5-year-old girl presented with redness in right eye for 10 to 15 days, not associated with discharge, watering, photophobia, no history of trauma. In right eye, vision was reduced and IOP was measured with non-contact tonometer, 48 millimeters of mercury. 2 mm ptosis with good LPS function was seen in right eye. Left eye had normal findings, also seen in the following image. And in pupil in right eye was mid-dilated fixed with 360-degree ectropion Uveae, and in fundus examination, glaucomatous changes were seen with almost near total cupping and bayoneting of vessels. Management, IOP was controlled with oral and topical anti-glaucoma medication and patient was immediately advised for both eye examination under anesthesia and right eye trabeculectomy with mitomycin C. On discussion, congenital ectropion Uveae is a rare non-progressive neural crest cell disorder. Progressive open-angle glaucoma may be associated due to dysgenesis or endothelialization of the anterior chamber angle. Neural ectodermal origin of Mueller's muscle explains the presence of mild ptosis with good levator function in our patients. Glaucoma filtration surgery with or without antimetabolite is treatment of choice for glaucoma. After surgery, patient was benefited symptomatically and cosmetically with improvement in vision. Retrospectively, patients presented with ptosis should be evaluated for CU and glaucoma for early diagnosis. Thank you.
So how often have you must have read about it, how often has the association been reported?
Ma'am, congenital ectropion Uveae, it is usually a rare presentation, usually unilateral. often it gets missed, and bilateral, it's rare, very rare, but it's a rare phenomenon.
And
Congenital
association with ptosis?
association, I have seen 5 patients till now.
Five.
Yes, ma'am.
You read about 5 cases till now.
Like in, I have seen patients.
No, these 3 cases you have reported, have they been reported?
At that time, it was when I wrote this, it was 3. After that, it was in some patients like neurofibromatosis also it was associated in one patient, and one patient had like this had craniofacial defect. Other patient, there was no such acid finding.
But in your patient, no neurological association was seen in
In
3
one
of
patient, as I've mentioned over here, it has craniofacial defect,
Okay.
and another patient I've seen that has neurofibromatosis associated, and other had no such systemic associations present